Hi, my name is Elaine Walsh. I'm a fourth year general nursing student in the University of Limerick, and this presentation is on patient and family experiences of advanced care planning, and this is a focused mapping review. So what is advanced care planning? Advanced care planning, which will be referred as ACP in the slides from here on, is the development of a plan of care where patients make decisions about various aspects of future care. Their preferences are outlined and it will be put in place when they lose capacity to make these decisions themselves. Advanced care planning is not solely focused on the patient's death, but ensures that they live their life to the fullest, despite their diagnosis, and as they approach the end of their lives, they could die with dignity in their place and manner of choice. Advanced care planning is commonly associated with those diagnosed with a long progressive disease. However, this focused review will focus on advanced care planning in those who are receiving palliative care, as there is also a strong association between palliative care and advanced care planning. So, a background to this review. The WHO defines palliative care as a method of care that enhances both patient and their family's quality of life as they face a chronic, life-altering illness by early detection, thorough assessment, and by treating pain along with physical, psychological, or spiritual problems. Advanced care planning is not a common concept in Irish healthcare. Advanced Healthcare Directives, which is a legal document outlining patients' wishes and desires for care, these were only legislated in 2015. The Irish Hospice Foundation have the Think Ahead initiative in place. This encourages patients and their families to talk about future care, and they can fill out a document to plan their care. But there is minimal support for healthcare professionals to facilitate advanced care planning in their care also. They suggest that there are multiple barriers to implementing advanced care planning into care, which will be explored later. The aim of this focused review. The Pico Framework was used to develop an aim to this review. Pico is one of many frameworks available to people carrying out research. It helps outline their research and helps them to outline the aim of their research. It focuses them on their research and what they need to find from the information that is available. So Pico has 4 terms. So there's the population, which in this case is the patient and family, the intervention, which is advanced care planning, comparison, which is not applicable in this study, and the outcome, which is experiences of patient and their families. So therefore, this outlined the aim, which is to explore how patient and families' experiences of advanced care planning can be used in the development of an advanced care planning model here in Ireland. So the focus of this review is to examine patient and families, their experiences of advanced care planning, how healthcare professionals can help these conversations, and what supports need to be put in place to facilitate patients and healthcare professionals in advanced care planning. The author will use these experiences to suggest a way in which an advanced care planning model can be developed in Ireland based on models in other countries and initiatives already in place in Ireland. All the information was published during a specific time period of July 2020 and July 2021. This ensures the latest research was going to be reviewed. Next, I will discuss the search process and results. A broad search was first carried out on various databases, Scopus, CINAHL Complete and Medline, to ensure enough information was available on the topic and to identify my journals. The Pico Framework helped identify search terms and was used for a broad search, and OR was used to narrow down the search. The following 2 points then are terms that I used in my search. So then 5 journals were chosen based on relevance to the research being carried out. Each journal then was searched individually and 22 relevant articles based on their title were chosen. Those 22 articles were all skim-read and based on their abstracts, 10 were unsuitable. An abstract to a paper is like a back cover of a book. It explains what the paper entails, so based on that information given, I see that 10 were unsuitable to my research. The remaining 12 articles were fully read. 5 were chosen to be most suitable according to the aim and focus of the review. The 5 journals that were chosen were the BMC of Palliative Care, ANLs of Palliative Medicine, Supportive Care and Cancer, Journal of Palliative Care, and Journal of Hospice and Palliative Care. Then the 5 papers that were chosen from these journals are listed below. These papers were ethically approved. They adhere to my inclusion and exclusion criteria, and also they related to the focus and aim of this review. So here we see a data extraction table. Data extraction table is often used in research. where the author can extract evidence from their papers and put it into one place. It allows them to see the key findings and compare and contrast information gathered from research. This is also a modified data extraction table, so I adapted the titles to suit my review aim and question and the information I wanted. Therefore, I was extracting the evidence necessary to my research, which allowed me to identify the key findings, which will be discussed in the next slides, and it also allowed me to compare the information provided. So there was 4 main key findings from the data extracted, and this was one of the most common findings in each of the papers. The conversations between healthcare professionals and patients and their families is often affected by time in the acute setting, but also by the use of medical terms or medical jargon. These terms often go over the patient's head and they don't quite understand a lot of the conversation that has just occurred. However, when adequate and understandable information surrounding their disease progression is provided, it is reported that it empowers the patients and allows them to reclaim control of their lives when it can often be taken from them following a disease diagnosis. Increased knowledge also gives the opportunity to these individuals not only to plan their goals and wishes for their care, but also practical elements of life with a serious illness and prepares them for medical emergencies in the future. The second key finding found was that healthcare professionals are to initiate the advanced care planning conversations. These conversations are not often initiated by patients or their families, as they are afraid that differing opinions surrounding treatment and care could cause upset and harm between them. There are multiple arguments from healthcare professionals as to when is the best time to initiate this conversation, whether it be when they are first diagnosed, when they reach palliative care, or for instance when they reach end-of-life care, which in this case it would be too late as they won't have the appropriate time to plan their care. However, whenever it is suitable to initiate these conversations, it is seen as the duty of the healthcare professional to start these conversations. Zwackman et al. Suggests that if healthcare professionals wish to discuss advanced care planning to their patients and their families, that it should be announced and planned with all parties. This allows patients and their families to prepare for the following discussion. The third key finding found was that there was a lack of healthcare professionals' understanding and awareness of advanced care planning. Patients and their families felt that healthcare professionals did not value or realise the need for more information to be provided in order to make informed decisions. They also suggest a lack of support services available to patients, and they are relying on family for emotional and psychological support, which may be adding further stress onto family members. In one of the papers, it is stated that advanced care planning conversation should occur even if the patient shows signs of whether they are ready or not. The healthcare professional should steer the conversation according to their willingness to participate. The fourth and final key finding in this research was that communication in advanced care planning needs to be improved. Like all aspects of care, communication is crucial in providing advanced care planning to patients and their families. Patients want healthcare professionals to be open and honest with the information provided and transparent about the disease progression, and this helps build trust between the healthcare professional and the patient. According to the patient and their families, there are 4 goals of communication as seen there. So how can this evidence be applied to practice? Information surrounding advanced care planning needs to be more widely available to patients and their families and accessible to all, especially with those with lower health literacy. This means ensuring the information is understandable and accessible to all patients. Healthcare professionals require more training on advanced care planning communication, initiating these conversations, and developing self-awareness. The nurse's role in advanced care planning needs to be developed, as they are playing a crucial role in increasing uptake in advanced care planning, as they often have a closer relationship with patients. More research needs to be carried out in Ireland on advanced care planning, its uptake and how it can be improved. The development of an advanced care planning model can be applied then based on this information. So the limitations to this research. When beginning this research, I felt a model could be developed based on other countries and their models of advanced care planning. However, it is evident from the findings that advanced care planning needs to be improved globally, with the findings coming from 5 different countries. There was also a significant lack of Irish research in regard to advanced care planning, with the last official publication in Ireland associated with advanced care planning being in July 2016. The time restraints of an undergraduate degree only allows for a small window of time for research to be carried out. However, this research gives light to the advanced care planning and hopefully will influence others to continue this research. Research is essential for evidence-based practice, where it is valued and central in nursing practice. So to conclude, it is clear from the evidence provided that advanced care planning needs to be improved, not only in Ireland but across the globe. My hope is this focus review highlights the need for advanced care planning conversation in Ireland and further afield needs to be reignited, and the continuation of research will aid in the development of a competent advanced care planning model which supports healthcare professionals, their patients and of course their families. Thank you for listening. I hope you enjoyed my presentation.